So non-epithelial adipose tissue lipoma, liposarcoma, and adult fibrous tissue fibroma, and fibrosarcoma, myxoma, sarcoma, cartilage chondroma, chondrosarcoma, bone osteoma, osteosarcoma, synovium, benign synovioma, synovial sarcoma, smooth muscle leiomyoma, leiomyosarcoma, embryonic fibrous tissue rhabdomyoma and rhabdomyosarcoma. So, and this classification again, this is of mixed tumors, that is tissue of origin is salivary glands. If it is benign, pleomorphic adenoma, malignant mixed salivary tumor. And then tumors of more than one germ cell layer, that is totipotent cells in gonads or in embryonal cells, we call it as mature teratoma and immature teratoma. So if you see this picture, this blue colored man is representing a normal cell, and this yellow is benign tumor, pink is malignant tumor. Benign tumor, though it is residing behind these normal cells, it does not cause any damage to this normal cells. When coming to these malignant cells, they will cause harm to this normal cells by residing it. And then coming to this picture, so these were non-cancerous cells. No, so this pink one is cancerous cells, blue were normal cells. So it does not cause any damage. So salivary glands, pleomorphic adenoma, totipotent cells, mature teratoma, salivary tumor, malignant salivary tumor, immature teratoma. So this is the picture showing this is a normal cell, this is a benign tumor. So benign tumor does not cause any harm to these normal cells even though it is residing behind it. These malignant cells, it will cause damage to these normal cells. This blue man is normal cell, yellow is benign, pink is malignant. If you consider this pink one is malignant cells. So this is a benign tumor. So these were the normal cells. It does not cause any damage to these normal cells. When coming to malignant cells, these were the normal cells. These will come out of this tumor and will spread to different tissues, surrounding tissues. This is the difference between benign and malignant. So differences between benign and malignant tumor, it is very much important for your exams also. So in that, clinical and gross features, boundaries, benign is surrounded by one capsule like thing, it is encapsulated. When coming to malignant, it is poorly circumscribed and irregular, and it may cause spreading of these cancerous cells into the surrounding tissues. And surrounding tissue is often compressed because of this benign tissue. If its size is increasing, it will cause the compression of this surrounding tissue. It should be like this. If its size is increasing, it causes the compression of this surrounding tissue. Malignant tissues usually invaded, that means it will spread to the other parts. Size, benign tumor size is less. This is often larger. Secondary changes occur less often in benign. It occurs more often in malignant because it causes damage to the surrounding and the host cells. Then microscopic features, if you see it under, if you see this tissue under microscope, these kind of changes can be seen. Here the benign cells, they will resemble the tissue of origin a bit slightly, whereas malignant, they won't resemble this tissue of origin. Basal polarity retained, here the basal polarity was lost. Pleomorphism, that is changes in these nucleus, can be seen, usually not present. Here these changes can be seen. And nucleocytoplasmic ratio is normal. That means size of the nucleus is proportional to cytoplasm. But in malignant, the nucleus size is very much big, larger and darker. So because of that, this ratio will be increased. Anesonucleosis is absent, here present. Hyperchromatism is not there. Here hyperchromatism is there. Mitosis may be present, but sometimes typical mitosis. Here there is no such kind of things will be seen. Tumor giant cells may be present. Here, completely tumor giant cells only can be seen. Chromosomal abnormalities are equal here present. Functions usually well maintained. Here it is retained, lost or become abnormal. In coming to growth rate, benign, slow growth. It is rapid growth in case of malignant tumors. Local invasion cannot be seen in case of benign. Only it causes the compression of surrounding tissue. Here, malignant, they cause invasion of the certain surrounding tissues, cause infiltration of these malignant cells into surrounding tissue. Metastasis is usually absent here. In malignance, here there is metastasis. Metastasis is nothing but spreading of or invading of these cancerous cells and entering into systemic circulation, and from there to different parts of the body, that we call it as metastasis. And prognosis, here local complications can be seen because of the pressure created due to compression by this benign tumor on the surrounding tissues. Here sometimes it may also cause death by local and metastatic complications. So these were the differences between benign and malignant tumors. If you see in this picture, these were the normal cells, these were the malignant cells. So these will be continue to growth and divide. These were irregular in shape, size and shape. Here the nucleus is proportionate to the cytoplasm. Here the nucleus is very much large and the shape is abnormal, and the shape of the nucleus is also changed. And here these were the genetic material. Their arrangement is proper and fixed. Here their arrangement is abnormal and the number of chromosomes is also abnormal. Here these were the cluster of cells here forming a bond. These were the cluster of cells. Here there is no boundary between each cell. So this was the boundary of each cell. So that kind of boundaries cannot be seen here. There is no clear boundary between the cells forming a tissue-like appearance. So these were the certain pictures showing these myomas. Leiomyoma is nothing but smooth leiomyoma of uterus. If you see here, this is sarcoma. If there is involvement of this mesenchymal tissue, we call it as sarcoma. If there is involvement of epithelial tissue, we call it as carcinoma, right? But myoma means benign tumor. Here the tumor is benign. That means it will be consistent to a particular part forming an encapsulation. Here it is spread continuously and it is very much big in size. There is no proper shape to this sarcoma. And this is the fibroadenoma of breast. This is more commonly seen in women, and this will be like encapsulated tumor, hard in size, and this will compress the surrounding stroma or soft tissue. When coming to this carcinoma, it will be spread to it will spread this way, and it will cause a different shape of this shape of the breast also will be altered because of this malignant tumor, but that cannot be seen in case of benign tumor. And this sometimes it may get entered into systemic circulation, causing the metastasis in advanced stages. So this is all about the differences between benign and malignant tumor. And then coming to pathological diagnosis of cancer. So the main methods for the diagnosis of cancer include radiological diagnosis, cytological diagnosis, histological diagnosis, frozen section, hematological diagnosis, immunohistochemistry, molecular diagnosis, and tumor markers. So we'll be going through this in detail. So coming to histological methods, what do you mean by histo? Histo is nothing but tissue. So we'll be checking the tissue we'll be comparing the normal tissue with this cancerous tissue, and we'll be checking this. So in this what we'll be doing, we'll be taking the tissue from that organ which is suspected to be having cancer, and we'll be fixing it in 10% of formalin under light microscope. And if it is for electron microscope, we'll be using this glutaraldehyde to fix the tissue. So this is how we'll be checking this tissue under microscope, and we can compare the normal tissue with this cancerous tissue. You can see the changes which I have discussed in the differences between cancer cells. Okay, and then quick frozen section. So, and hormonal analysis are also done. Quick frozen section is nothing but the tissue, whatever it is there, it will be made, it will be made into frozen piece, and then it will be cutted. It will make into a small piece, and it will be examined under microscope. That is frozen analysis. And hormonal analysis. Hormonal analysis can be done for breast cancer, cervical cancer, and so there will be changes in this hormonal level because of this cancers. The hormones levels also will be elevated. So if there is high abnormal elevation of these hormones, that also indicates the presence of tumor. And then morphological features of benign tumors resemble those of normal tissue, that if when we examine under microscope, benign tumors morphology will be similar to that surrounding tissue. When coming to malignant tumors, it will be very much difficult, it will be very different, so much difference can be seen with the tissue of origin. and there will not be any proper differentiation, won't be there. Anaplasia, silver atypia also can be seen. So these were the methods which will be used. So how the tissue will be collected by a process of biopsy. So biopsy is nothing but see, some needle like thing, this will be inserted into the tissue, and from that tissue a small piece will be removed, and which is examined under microscope in order to identify whether there is presence of cancer cell or not. So endoscopy is nothing but they will take a camera and it will be entered into the mouth. From there to they will send one camera like thing, and from that when it is entered into the stomach, they will collect a small piece from that region. That we call it as endoscopy. Scope will be sent from the mouth till the stomach or duodenum, till that it can move. And then needle biopsy, this long needle will be taken and it will be inserted into the tissue, and from that one small piece will be taken. And then surgical biopsy, if it is for breast cancer, they will make a small incision, and once this incision is done, excision will be done. Excision is nothing but a small making of the small cutting, we call it as incision, and excision is nothing but will be opening it in this way, and from that tissue will be collected. That is called excision. So surgical biopsy is, this is how we'll be collecting the tissue. And then cytological method. So it consists of different methods, that is exfoliative cytology and FNAC. So whatever the cells, tissues which will shed off into the body cavities, that will be collected and they will be examined for study, like in urine examination or blood, some kind of cells or tissues which is seen in these body cavities, that will be collected. And then FNAC, that is fine needle introduced under vacuum, fine needle aspiration cytology. That means a small fine needle will be inserted into this tissue where we are going to conduct this test, and under vacuum it will be collecting one small cells as it will do some aspiration. So we'll be keeping that vacuum. So this, when we are inserting this needle over there, because of this vacuum, some piece of this tissue will be collected. So that we call it as FNAC. So exfoliative cytology can be done for pap smear. For cervical cancer, we'll be taking this pap smear, whatever the tissues which were moved into the body cavities, that will be collected. It will be generally used for uterine and cervical cancers to identify that. And also it can be used for sputum and bronchial washings, pleural, peritoneal lining, urine, pericardial effusions, gastric secretions, cerebrospinal fluid. So all these were the body fluids which were found in different parts of the body cavities. So from that, we'll be collecting this piece and we'll be going for this test, that we call it as exfoliative cytology. And then fine needle aspiration cytology, as we said that fine needle will be sent along under vacuum and this piece will be collected from the deep seated masses like intra-abdominal, pelvic organs. And this can be done under using ultrasound guided or CT guided fine needle aspirations can be done. So in this, whatever the tissue or cells that were smears which were taken, that will be kept in 95% ethanol, and then will be air fixed and they will be fixed under microscope. So the reliability will be like between 90 to 97%, but it must not be substituted for clinical judgment. Only we cannot depend mainly on this, but we have to go for clinical judgment depending on the histopathological biopsy. And then histochemistry and cytochemistry. So like chemistry of these tissues and cells can be studied by different staining methods. So for that, we'll be using this for glycogen, pass with diastase loss, glycoproteins pass with diastase, para-aminosalicylic acid, PAS means, acid mucin, allicin blue, mucin combined allicin blue, PAS. So these were the different strains that we'll be using in order to identify the substance. So that we call it as histochemistry and cytochemistry. And immunohistochemistry, so it's an immunological method. So in this, we'll be collecting a few antibodies, and again we'll be fixing it under microscope with some help of some agents like any solutions or agents, and then we'll be examining under microscope. Okay. So for fluorescence studies, we call it as fluorochromes, and for enzyme studies, we'll be using chromogens. So intermediate filaments like keratins, if it was found, then it is considered as carcinoma or mesothelioma, some germ cell tumors. Vimentin, sarcomas, desmin, mucogenic, myogenic tumors, neurofilaments, neural tumors, glial fibrillary acid protein, glial tumors. So this is how we'll be detecting with immunohistochemistry. And then tumor markers or biochemical assays. So there will be, as I said, that for every cancer cell on their surface, there will be certain markers that we call it as proto-oncogenes. So with the help of these, we'll be identifying which type of cancer it is. So if there is any oncofetal antigens like AFP, carcinoembryonic antigen, it will indicate the presence of hepatocellular carcinoma, cancer of bowel, pancreas, and breast. And if there is enzymes elevation like prostate acid phosphatase PAP, it indicates prostatic carcinoma. Neuron specific enolase, that is NSE enzyme, is elevated, it indicates neuroblastoma or oat cell carcinoma of lung. Lactic dehydrogenase elevated, it indicates lymphoma or Ewing's sarcoma. Hormones like HCG is elevated, it indicates tumors of testis. Calcitonin, medullary carcinoma of thyroid. And catecholamines and vinyl mandelic acid, neuroblastoma or pheochromocytoma. Ectopic hormone production, pancreoblastic syndromes. And cancer associated proteins like CA125 for ovary, 15-3 breast, CA19-9 colon and pancreas in breast, CD30 hair cell, Hodgkin's disease or anaplastic large cell lymphoma, CD25 hairy cell leukemia, adult T cell leukemia lymphoma, monoclonal immunoglobulins, multiple myeloma or other gammopathies, prostate specific antigen, prostate carcinoma. So these were the cancer associated proteins. These were the hormones which when elevated will be identifying this kind of cancers, and enzymes. If these enzymes are elevated, it will indicate the presence of this kind of cancer. And oncofetal antigens, this will be seen in newborn babies. So this is all about this. All these will be indicates the tumors. So this is considered as tumor markers. So this is how we'll be diagnosing the cancer. These are the different methods of diagnostic methods for detection of this cancer. So with this, we'll be completing our other topic. Thank you.